Got the job in January, and just weeks later, Dr. Arwady walked into the biggest health story of our lives. She's become something of a household name around here, appearing at daily briefings with the mayor, and she gave us a few minutes this afternoon to talk about what's ahead as we approach summer in Chicago. You get one question with Dr. Arwady, what would it be? And it was pretty unanimous. When is this over?
So we're still watching the data. That's the million-dollar question, but I don't have an exact date. I think as we look ahead, it's important for people to recognize, not just in Chicago, but around the country and even around the world, there's going to be a series of adjustments. So I think people sometimes will say, oh, it's going to be great, right? Like in a couple of weeks, I'm going to go out to the bar, like we're all going to go celebrate. And it's not really going to be just like that, because as opposed to a light switch where we're turning everything back on, we're going to be more like a dial, right? Where we're opening things in a careful way, continuing to think about social distancing, continuing to think about following cases, watching what's happening with the data, making sure that our health system remain in a stable place, and then taking another step.
What was going through your mind when you knew things were about to change dramatically?
What happened was we started seeing cases, and we started seeing cases in a way that though the numbers were low, we were detecting them in a couple of places, although the numbers were small, doubling, right, in a day, in 2 and 3, where you go from 2 cases to 4 cases, 4 cases to 8 cases, 8 cases to 16 cases. We knew that there already was a fair bit of spread, and we really needed to be thinking carefully about needing to change things about the way we practice. Making that decision was hard, but we knew, sort of talking to folks around the country and conferring with the mayor, that this was going to be the right thing to do.
What worried you the most about that stay-at-home order?
The way that the numbers were going, if we had not seen good adherence to that stay-at-home order, we knew that we were in big danger of overwhelming our health system.
A lot of parents want to know if their kids will be back in school in the fall. How would you answer that?
Certainly by the fall, we're going to have a much, much better sense about all kinds of questions related to this virus. I think the fact that children, by and large, have been spared, in most cases, the very serious outcomes here. We've not seen a lot of hospitalizations or deaths in children, is one piece of very good news here. The question really is their role as potential carriers of the virus. But by fall, you absolutely will have the widespread antibody testing, where we'll have a sense of whether people have exposed to have some level of immunity to the virus. We'll have a much better sense of how and where this virus spreads. We'll be able to have, I am positive, the kind of testing that we need.
What does summer in Chicago look like?
We are going to have a sense of not just where we are, but where others are around the country. It's one thing to have your particular area in control, but if you are starting to see a lot of movement or events that may bring people from around the country, thinking about what that looks like. So we're really not wanting to be premature about making specific decisions.
Are you worried about a second wave?
We do recognize that when people are out and moving, we will see more cases. That's why we need to have the testing infrastructure well in place, and we need to have the public health contact tracing, the ability to do the quarantine and isolation, and the ability to make sure that we're really keeping people safe. We'll see more cases, that goes without saying. The goal is really obviously to make sure that we get people back to work as we can, that we start bringing back a lot of the things that really we enjoy most in life, but it's got to be in a way that is safe and does not lead to a big surge. If you go too fast, too far, and then have to take a big step backwards, that can have worse effects on the economy and probably on people's psyches. So, we want to do it carefully and thoughtfully, and support people.
Dr. Arwady loves Chicago so much she volunteers as a docent on Chicago's popular architecture tour. She hosts them, and she admits packing people on a boat this summer may not happen, Ben, but the idea of maybe having a handful of people spread out, social distancing, that might happen, but we'll see. A lot of this stuff still up in the air.
And people may not realize she's got some impressive credentials coming into this job.
Yeah, she's worked for the CDC. She's helped to cover the Ebola situation, MERS. I mean, yes, we're lucky to have her for sure. Along with we should mention Ezike as well on the county side. Really impressive medical health experts that, on the front lines for us here.
Indeed. Joe Don